Scientists based in Qatar have identified a coronavirus mutation that may lead to a COVID-19 test returning a false negative. The findings have been published in the Journal of Clinical Microbiology. The study calls for testing centres around the world to monitor mutations and ensure testing methods are up to date. Well, Dr. Patrick Tang is Division Chief of Microbiology at Sidra Medicine. He's joining us live by Skype from Doha. It's good to have you with us in Al Jazeera. Thank you very much indeed. Can you explain to us, first of all, what a false negative is?
First of all, thank you for having me. And maybe I'll make a minor correction to that. It's not technically a false negative, but it's a potential for a false negative result. So this is a virus that we detected in our laboratory that had a mutation that knocked out one of the detection targets for the virus. So in most labs in the world, they would detect multiple targets in the viral genome to be able to have a higher confidence that you are detecting the virus. And the other thing is that if the virus were ever to mutate, it could potentially knock out one of these detection targets. So you need to have more than one in any good laboratory to be able to confidently detect the virus.
So what does this mean for testing programs around the world that have been going on?
Well, this is a reminder of two things. One is that the virus is constantly mutating. So every time we give the virus a chance to enter a new host, there's a chance for it to mutate. And it also is a reminder that our diagnostic systems are very robust in most parts of the world, that we're able to pick up these mutations and characterize them, find out what the mutation is, and then publish it in the scientific literature so that all the other scientists and doctors around the world are also alerted to these possibilities.
If I understand it correctly, no other country so far has reported this. How did you and your teams manage to discover this?
Well, these mutations are random and is sort of somewhat luck, and in that somebody here that came to our hospital had this mutation. Several people had this mutation, and this mutation is probably circulating in many different parts of the world. But because we don't have the capacity to do a lot of genome sequencing of the virus in many parts of the world, we would probably miss this. So what would be more concerning is to have many of these mutations develop silently without us knowing about them.
So now that it's been published in the Journal of Clinical Microbiology, presumably that means that countries around the world should go back to their testing processes and just reaffirm that they are testing for as wide a range of possible mutations as they can.
Exactly. So after we published this, many of my colleagues in North America also reached out to us to find out more about this mutation, as well as the company that produces this commercial test for the virus. So, this is definitely a way of starting that dialogue and making sure everybody has robust tests for COVID-19.
Dr. Patrick Tang, Division Chief of Microbiology at Sidra Medicine, thank you very much indeed for being with us.
Thank you.